Welcome dear student, today I am going to talk about the sternum. Here you can see this bone is called the sternum, which is also called the breastbone. The sternum is a Latin word which means the short sword. So here you can see the sternum have three parts. This is called the minubrium. From this point up to this is called the minubrium. And the body of the sternum, this is called the body of the sternum. But here there are a process which is called as a zippoid process, but here it is missing. So it is just like a sword shape. Here the minubrium represent the handle of the sword. In this body of the sternum represent the blade of the sword, while the zippoid process represent the tip of the sword. So first I am going to talk about the minubrium. Here you can see this bone is called the minubrium, which is a part of the sternum. The minubrium have two surfaces. One is the interior surface. Here you can see it is rough and it is convex. And the other is posterior surface, which is smooth and concave. And it has four border. One is the superior border. Here you can see this is called the superior border. The other is inferior border, which is articulated directly with the body of the sternum through an angle which is called sternal angle. Here you can see there is a slightly posterior deviation of the minubrium above the upper end of the body of the sternum. This angle is called sternal angle or angle of Lewis, which has some clinical importance, and it is about 163 degree. So the upper end of the minubrium, the upper border of the minubrium, here you can see there is a notch. This notch is called a sternal notch. Here you can see. And there are two depression or notches on either side of the sternal notch. These are called a clavicular notch, which is articulate with the medial end of the clavicle. And the two lateral border. There are two lateral border. We have talked about that there are the four borders. One is superior, the inferior, and the two lateral border. And lateral border of the minubrium, there are articular facet, complete articular facet for the first rib, for the cartilage of the first rib. Here you can see. And there is a facet which is called a demifacet. Here you can see this is called a demifacet for the second costal cartilage. For the second costal cartilage. And there is a corresponding demifacet on the body of the sternum. Here you can see the second rib is articulated here. So here you can see this is called the body of the sternum. It has two surfaces. One is the interior surface, which is also rough, and the other is posterior surface, which is smooth. And the interior surface is convex. Here you can see, and the posterior surface is concave. And it has two ends. One is the superior end, and the other is inferior end. The superior end is articulate with the minubrium. Here you can see, and the inferior end here it articulate with the zippoid process, but here the zippoid process is missed. And there are two border. These two are called the lateral border of the body of the sternum. So the lateral border of the sternum have articulate facet for the cartilage, for the articular cartilage of the ribs. There is a demifacet for the second costal cartilage of the rib, for the third and fourth, fifth, and a demifacet here for the sixth costal cartilage of ribs. So inferior end of the body of the sternum is articulate with the zippoid process through the zipisternal joint. And the zippoid process have two surfaces, but here the zippoid process is missing. It has interior surface, the posterior surface, and there is a tip which is maybe monofid, bifid, trifid, or so this was all about the sternum. For more videos, subscribe, like, and share.